Dying in jail sounds like a terrible way to leave this world.
But dying in jail and in agony is what witnesses say happened to 35-year-old Michelle Bewley less than 33 hours after she was booked last March. At the time, the Clay County Sheriff's Office says its employees acted appropriately.
After an investigation by the state, the jail made some changes. But as Troy Kless reports tonight, Bewley's treatment is reflective of how some agencies have been slow to cope with the opioid crisis.
She screamed all day, and then that night she passed away.
Inmate Brittany Wink was in an adjacent cell F2 the night Michelle Bewley died.
She was just screaming that she was in pain. You could tell they were like pain screams.
The Orange Park mother was arrested March 4th on charges of stealing jewelry, makeup, and clothes from a Clay County Belk department store. According to a later investigation, when she was booked, she was loud, aggressive, crying uncontrollably. She was placed on suicide and disintox watch, short for disorderly intoxication, a recognition that she was on some kind of intoxicant. According to jail protocol, that meant a deputy was required to check on her every 15 minutes. Logs show that happened, but she did not begin getting medication for her withdrawal symptoms for 20 hours. She was initially given Pepto-Bismol for nausea and Ativan for anxiety. After she vomited the medication, nurses gave her an injection of Ativan. They did the same thing 4 hours later. They told FDLE investigators her vital signs were good, but noted that she was cold, grunting, and moving around too much to let them listen to her lungs. Nursing staff tried to reach the on-call doctor, but he did not call back.
The sheriff's office rules say that they are required to take an inmate to the hospital if they are experiencing withdrawal symptoms. According to a nurse who was quoted in an FDLE report, she did not think that Bewley's symptoms were severe enough.
So Bewley was left in her cell. 4 hours later, a deputy shook her shoulder. She told investigators she thought her foot moved, but couldn't be sure and didn't check any further. At 8:20 p.m., staff found her in her cell, unresponsive. Emergency crews said when they arrived, it appeared Bewley had been dead for hours.
And I get a phone call about 3 o'clock in the morning, 3:30, and they're saying, we found your daughter deceased in the jail cell.
She last spoke to her father, Stephen Mollahan, on the phone days before she was booked into the Clay County Jail.
I sent her some money. She said, I told Michelle, I love you, Dad. And I said, I love you, Michelle. That's the last I remember. Turned my world upside down. You know, my only kid dead. He's supposed to be looking after her.
Nobody tracks withdrawal deaths in jail, but a report by the National Sheriff's Association estimates as much as a quarter of inmates are addicted to opioids. Dr. Raymond Palm specializes in treating opioid addiction. He says the kind of medicine the jail provided is not effective for someone experiencing withdrawal symptoms.
Ativan is not going to interact in an adverse way to cause a worsening of her symptoms. It just won't treat the symptoms effectively enough.
A medical examiner's report says Bewley's manner of death was natural due to hypertensive heart disease, but listed chronic drug abuse and opiate withdrawal as contributing factors. Both fentanyl and cocaine were found in her system.
Not that the jail giving Ativan would make it worse as much as not giving the other medications that would help it would have given her the best chance to survive.
The Clay County Sheriff's Office says no deficiencies were found in the FDLE report. They state the jail and medical staff responded to the needs and treatment of Bewley appropriately. Attorneys for Bewley's family say they are planning to file suit, challenging the quality of her care and the fact that 911 was not called until it was too late.
They sent her to the emergency room. I think people who was other human that way, not even care about it.
The Clay County Sheriff's Office declined our request for an interview and would only answer questions in writing. We asked if their protocol for treating inmates experiencing withdrawal have changed since her death. They said no. They also said that no employees were disciplined. However, they did say that although there were no deficiencies in the FDLE's report, the jail now houses medical needs inmates in a medical housing unit where they're overseen by nursing staff and deputies. They say that change was made after Bewley's death, but not as a result of it. Troy Kless, First Coast News, on your side.